always do some type of a little health segment here on the Common Sense Show. Want all my listeners to stay healthy so you could be around to listen to me for a long, long time. We're going to talk about your heart today. It seems like there's been an increase in heart problems and more people having cardiovascular problems or diseases that flip off from how your lifestyle is carrying on. Dr. Robert Edmonson is an expert on heart disease. He's a cardiovascular disease doctor for 23 years. He served as medical director of cardiology at Methodist Hospital of Dallas. Sure glad to have him on the program with us here today. Hey, Dr. Edmonson, glad you joined us on the Common Sense Show.
Well, thank you. Glad to be here.
Let me ask you, Doc, I was concerned. It seems like there's so much more about heart health in the news today. Is that an indication that people, we read all these articles in terms of lifestyle, that we're much more obese as a country in America today, that it seems like problems involving diabetes or so many other areas seem to be on the increase, not on the decrease, and so lifestyle seems to be having a direct effect on heart. I guess my question to you, in your experience, are people getting more inclined to help themselves with heart problems, or do they just seem to go ahead and ignore it and feel like whatever happens, happens?
Well, it's unfortunately sort of very much an individual aspect to this. Some people clearly are getting more interested. And one of the areas that I'm a very big believer in is a vegan diet. I'm confident, I know that makes a big difference in our cardiovascular prognosis. And more people are being interested in it, particularly younger people. My burden is getting older people more interested in it, and they're the ones who already have the disease. But clearly, there is more interest. I think that's very positive. There's an epidemic of obesity in our country, and the diseases secondary to our lifestyle are basically preventable, and it's so important to be educated and to have this information.
Well, when you're young, and I guess I'm a prime example of that, I've been checked recently, and I've got some calcium buildup that went back, I guess, in my years 30s and 40s when I was working weekends and night to support my family, too tired to work out, meat and potatoes guy, or as I'm driving to a meeting, you grab a cheeseburger or something like that. And it took me, in the last 20 years, to get more focused and more heart healthy. But I guess my question is, I mean, are you doomed if you're 60 years old and say, listen, it looks like I might have some heart problems? Is it ever too late to get on a good diet and get on an exercise routine? Is there, can you do it at 60 or 70 and still make a difference?
Well, you certainly can. And I would like to say, though, that the implication you're making about your earlier lifestyle is also very important. So I think this question applies to young people as well as older people. Many people may not know this, but the Korean War unfortunately lost a lot of young men. They did autopsies on them, and 73% had evidence visible of streaks in the coronary arteries of plaque buildup. So when a person who's 55 or 60 suddenly has a heart attack, and gosh, how terrible it is terrible. This disease has been developing since they're very young. So it's never too... You shouldn't wait until you're older to begin change lifestyle. That has a direct impact on your prognosis. But to directly answer your question, clearly it can be stopped. Disease can be stopped, and that's one of the principal issues. But it can also be reversed. And actually, this information has been around a long time. And 20-plus years ago, Dr. Esselstyn at the Cleveland University heart disease. And he had cases with intractable problems that showed reversal. So, yes, sir, it's not too late by any means to make a difference.
I want to make that point clear to our listeners out there. If you've got heart disease, or even if you think you're fairly healthy, you check you got heavy plaque buildup, Dr. Edmonson, you're saying you can actually reverse that buildup of calcium by a strict diet and by exercise. Is that correct?
Well, the calcium is deposited in the plaque, and the plaque is what you would like to be able to reverse. The calcium, once it deposits, maybe not quite as reversible, but the calcium is not really the main culprit cause of the blockage. It's the plaque associated with it, and that plaque is clearly is reversible. And I have some patients I've seen who refer to me because they've had terrible vascular disease of lower extremities. multiple procedures, and so they said to me to try to do something about it. And most of them are overweight, have high blood pressure, cholesterol is not well managed, proper tests haven't been done. And so I'll tell those people this is actually exciting because look at all these factors you have going on that we can reverse. We can do something about this. Let's take this as an exciting time to change things in your life and change your outlook.
Now, let me make this clear for our listeners. A lot of the listeners are we're trying to educate them as we go along. Now, you said plaque can become, explain the difference between plaque and calcium. Does plaque become calcium, or, you got in your linings of your arteries that go into your heart? Plaque is the congealing substance that creates calcium, or how do the two relate? Explain the difference between plaque and calcium.
Well, plaque is an additional culprit. We all heard of the LDL, the bad cholesterol. It's carried by particles. If it's carried by a lot of small particles that penetrates into the wall of the blood vessel very readily, I might say parenthetically, the health of that blood vessel wall is critically important. That has to do with our lungs. The base of those particles penetrate into the inner line of the blood vessel, begin to set up plaque, grow in different type of inflammatory components, and the plaque begins to develop, and then calcium deposits inside the plaque itself. So the calcium is just a sign that the plaque is there.
So if you got calcium that's hardened, then you're not in that bad shape as long as you quit creating plaque, and the plaque just continues to build up and create more calcium buildup. Is that what you're saying?
Well, it depends on how much calcium is there, which has to do with how much is there. But clearly, if you find calcium present, there's plaque there. That's just the bottom line. The plaque without calcium, but it's generally not as advanced and been there as long. If calcium's there, you have plaque, and then you need to be addressing the plaque.
Now, how do you find out what your situation's like? I mean, you go to, say, a good internist, and the internist will take a blood sample, take a blood out, tell you, well, your cholesterol is, let's say it's 150 or 160, that maybe is pretty good, and they break down the LDL and HDL. Is just the blood sample enough to give you satisfaction? I hear people taking treadmill tests. I've heard about, where you can actually do a PET scan where you go in and put iodine in your vein. And so, I mean, how does someone who is, say, average person, 55, 60 years old, who wants to check to be sure they don't have any problems, they haven't had a heart attack or any shortness of breath, but they want that confidence level, what do they need to do to get that confidence level?
Well, the blood test is certainly important, as you're implying, and the cholesterol is important. The good cholesterol, HDL, is associated with removing plaque from the tissue. The LDL is the bad cholesterol, the positive. The LDL is carried by particles, so if you're going to have the blood test done, you should have it done by somebody who measures not just the LDL, but the particles. The LDL may be normal, but it's carried by a lot of small particles. It's very pathogenic, sets the plaque up. Carried by a small number of large particles, less dangerous. So basically there are issues there involved. But about 50% of people who come to the hospital with a heart attack, the LDL cholesterol is normal by current standards. So there are other factors involved, and that has to do with what creates our lifestyle. To directly answer your question about what the person can do, of course, the treadmill test would tell you an idea about what the status of the current blood flow to your heart.
And Dr. Edmonson, hey Doc, can I have you pause right there? We've got to take a break. I want to tell our listeners we're talking to Dr. Robert Edmonson. He's a cardiovascular disease doctor. He's been so for 23 years, and an interesting guy who's got a lot of good information for us. The website for Dr. Edmonson is MarulaMedical.com, MARULA Medical.com. You can find on my website at JimBrownUSA.com. Let's take a little pause right now. Fresh get your coffee. We'll come back and talk some more with Dr. Robert Edmonson.
Now, here's your host and professor of Thinkology, Jim Brown.
We're talking about keeping you healthy so you'll be around for a long, long time to listen to me on the radio. Makes good common sense, doesn't it? Dr. Robert Edmonson is our guest. He's a practicing cardiovascular disease doctor over in Dallas, Texas for 23 years. He served as medical director of cardiology at Methodist Hospital, and his website's on my website at JimBrownUSA.com. Doc, before the break, we were talking about ways you can tell if you've got some potential problems. You mentioned the blood test, taking your cholesterol level, and I took a break there where you started to talk about the treadmill test. Carry on, if you will, and give us some thoughts about what you should do to be sure that you don't have heart disease.
Well, the treadmill test is beneficial. It tells you what your heart reserve is. It tells you your level of conditioning, and also whether you have the obstruction in the arteries supplying blood to your heart. There are scans that can be done, nuclear scans, and the PET scan that you mentioned is very sensitive in detecting whether there's a decrease in blood flow to the heart, which tells you whether there's a blockage enough to restrict it. But the blockage has to be 55, 60, maybe 70% to show up with restriction. So the fact that you determine you don't have that is beneficial. It doesn't tell you whether you have a plaque that may be very aggressive, may be very active, and could then rupture, attract the blood clot, and cause a heart attack. That's why a person can have a heart attack after a stress test. The doctor said you're fine. So that goes back to lifestyle. We need to be addressing our lifestyle to be sure we don't have aggressive plaque or cholesterol medicines if it's appropriate. But from the standpoint of what you actually have, in addition to determining about the flow of blood to your heart, the calcium score of the coronary arteries is very valuable. It's a technique done with the CT, CAT scan. The amount of radiation is similar to a mammogram. It's not that much. And the amount of calcium deposited in coronary arteries is a direct reflection of your prognosis. Now been recommended as the most sensitive test by American College of Cardiology, American Heart Association, and I believe it's very, very worthwhile. It gives you the degree of calcium, the degree of risk that you have, and so that can tell you a lot about where you are. It can tell you need to have additional tests done because you're at a very high risk. But even if that score is favorable, it doesn't mean you should change your lifestyle because disease is progressive. And that doesn't tell you 5 years from now where you may be. So, yes, I think it's important to get diagnostic tests. We all want to know where we are. But the lifestyle changes are beneficial, and not just for heart cardiovascular disease, but for cancer. These same risks relate to cancer and dementia. And we follow the right lifestyle, we feel better. We have a better sense of life. So it's just an altogether a win.
Well, let's talk about that lifestyle. Now, you mentioned a vegan diet. What are the common sense? It's hard for people to understand often protein and a breakdown of carbs, but can you give some simplified examples of the kinds of foods you should be concentrating on and those you should stay away from? That's something that I think most listeners can understand pretty easily.
Well, it's basically, the vegan diet is basically plant-based. It differs from a vegetarian diet in that it avoids anything with the head or a mother. That's pretty aggressive, but it's basically true with 80% anyway. But it's basically things that grow out of the ground, and that's not an easy task for people. When I see patients with this problem, first of all, I have to explain to them what the fatty foods, what the animal products, the dairy products are doing to their body, and what the plant-based foods do for them, because nobody's going to make changes if they don't understand it. And so we should be educated about that really in junior high school. There are resources that are very valuable, very worthwhile. If you want me to, I can mention several that you can get more information about this type of diet. There are people who actually give weekend courses. There are websites, there are books. There's a lot of information about it. It's not easy to make that change, and it is fairly radical, but not as radical as having your chest open up and having bypass surgery.
That's exactly right. Well, now, and I've heard that, and I carry on basically a vegetarian, close to a vegan diet. Now, that's pretty hard that you say if it's got a face or a mother, you don't eat it, which means, now, what do you think they'll like about cold water fish, having a piece of salmon once or twice a week or something along that line? I mean, does that makes sense? Pretty hard to go out to dinner and eat nothing but plant-based foods. And then, as I say, then even if it's green beans and cauliflower, you got to caution in the restaurant, don't cook it in butter, and they say, well, we all cook it in butter, does fish make sense? Cold water fish make sense or not?
Yes, of course that's an issue with that question that you're talking about, and that's a struggle, and to make these changes requires a lot of education, a lot of commitment, a lot of desire to learn. But cold water fish salmon 2 days a week is fine. It has omega-3 in it, which is important. It is not nearly as disadvantageous to the body, and it has some value. But before I made my change, I read a book called Eat to Live, recommended by a heart surgeon friend of mine about 5 years ago, and completely changed the way that I eat, because I understood what the foods were doing to me, what these other foods do for me, and I've talked to patients about it ever since. When I went to a restaurant, knowing what I know, I still would have a baked potato with everything on it, and a steak and Caesar salad. Now, once a month, maybe my wife and I go to a restaurant, and we'll split an 8-ounce fillet. And I'll have a baked potato without the sour cream and everything on it, and maybe a few little things just to satisfy me. So once in a while, eating something a little bit different is all right, as long as you stay with the principle of the right things that you should be eating.
Yeah, let me ask you, since you're talking about specifics, do I understand that you should kind of stay away from caffeine if you're a coffee drinker, decaf? Is caffeine a factor in heart problems or not?
And that's all. And all the studies that have been done to try to prove it's not good have not shown that it's not good in moderation. There's atrial fibrillation is a irregularity to the heartbeat, which probably many of your listeners have heard about, because it's certainly very common. And caffeine tends to stimulate the heart and cause heartbeat irregularities. There was a study done which determined whether it was deleterious atrial fibrillation, which I was pretty sure it would be. Turns out that there's some compounds in that actually benefit the heart such a way that it tends to reduce individual. If you have it. So that's a long-winded answer to saying that there's really very little data that caffeine in small amounts is deleterious. I will say, though, that some types of teas have been shown to be actually beneficial. Caffeine is not shown to reduce the incidence of heart disease. It's not shown to be a promoter of it. But some of the types of teas have actually been shown to have a favorable effect.
Green tea, for example, decaffeinated green tea. That's kind of what I drink. I fix ice. In fact, I'll tell you what I do, Doc. I carry in my pocket when I go into a restaurant. I got a little plastic bag, and I put some stevia, as I use for my sweetener, and I put a little. I bring a few tea bags and tell the waitress, "Can you just have a pot of hot water and a glass of ice?" I make my own iced tea there, and they're all very willing to do so. But it's kind of how I do it to make it a little easier on myself.
I think that's very wise, and you're obviously making some real efforts at taking care of your health. I think it's so important that people realize they have so much more control of their health than they realize. And the proper education, you have control over your life. You're just not the doctor. I've told some patients if they do everything I tell them to do, they won't need me. Now, people have advanced disease, some diseases, some tests, statins are very important if you have advanced disease. There's a lot of things that we can do, but people can do more for themselves than I can do for them.
Well, now let me ask you about statins. You brought up statins. That was the final thing I was going to ask you about. I've had doctors tell me that, quite frankly, by the time you're 55 or 60, no matter what your situation is, you ought to be on a statin. A statin is the single best thing that you can take to moderate heart problems. What's your thoughts on statins?
The statins are clearly very valuable. I've been in practice a long time. Most of my career was first in invasive cardiology, where we took pictures of the coronary arteries, angiograms. When we developed angioplasties, I did angioplasty. We put stents in, did stents. And initially, when I was in practice, we didn't have the stent. And so we open up a vessel, get people stabilized, and then a year later, we have a blockage of another blood vessel. When we got the statins, that basically came to a halt. So all the bad things here about statins, certainly there were some questions about it, some issues, but you have to be thoughtful. But most definitely is a very important preventer of events. And I'm a big believer in it. And I think to say everybody over 50 should have maybe a little bit of overstatement, but it's not too far off. I think that there's a great deal of truth to that. But I might emphasize that, again, I said that people come to the hospital with a heart attack have a normal LDL cholesterol, a cardiac standard is probably not low enough. So there are other factors. If you reduce this to 50%, you got 50% left. You want to do other things to address besides just the statin.
I got it. And Doc, we are out of time. We got to do a hard break. Dr. Robert Edmonson, expert on heart disease. His website's on my website at JimBrownUSA.com. Doc, have a great weekend. We'd like to have you back again, and we'll be right back after this message.
You're listening to Jim Brown's Common Sense, right here on the Genesis Communications Radio Network at GCNlive.com.